Good afternoon and welcome to this webinar. I am Cassidy Avila from the Center for Optimizing Rural Health at Texas A&M University. We thank you for joining us today for USDA and Rural Health. How does rural development help with rural healthcare? So before I introduce our speakers, I do want to make a couple of notes for you guys. We will be leaving time for questions following the presentation. But do feel free to drop your questions into the chat during the presentation if you would like, and I will make sure that the presenters see them during the Q&A portion of the webinar. We are recording the webinar, and we will be sharing a link following the presentation. So you'll get an email in the next 24 to 48 hours, and that will include a link to the presentation, as well as the option to download the slides. And so now it is my pleasure to take a couple of minutes and introduce our speakers. So we have four speakers today from the USDA, and I'm going to begin with Ms. Kelly Cabina. Kelly serves as the USDA Rural Health Liaison in the Rural Development Innovation Center. Kelly has been with Rural Development for 7 years, and before that was at the U.S. Environmental Protection Agency for 17 years. Kelly has a bachelor's degree in wildlife and fisheries from Texas A&M University and a master's degree in fisheries from the University of Washington, where her research focused on aquatic toxicology. Also speaking today is Mr. Chad Parker. Mr. Parker has worked with USDA Rural Development for 31 years and is currently serving as the Deputy Administrator, Community Programs Administrator. In his unusual role as a Deputy Administrator, Community Programs, he's responsible for community facilities direct loans, guaranteed loans and grants, emergency rural health care grants, tribal college grants, and the Rural Community Development Initiative. Also speaking today is Ms. Teresa Hunkapiller. Teresa graduated from the University of Alabama and has an extensive background in rural telecommunications. In 2008, she joined the USDA RUS Telecom team as the General Field Representative for Alabama and Mississippi. In 2018, she was promoted to Field Branch Chief, overseeing GFRs across the country. In mid-2021, she served as the Acting Grant Management Specialist, and the position became permanent in early 2022. And our fourth speaker on the call today is Mr. Derek Jones. Mr. Jones is Branch Chief for the Public-Private Partnership Branch of the Rural Business and Cooperative Service. His main duties include managing a staff which focuses on outreach and establishing and maintaining business relationships with other federal agencies and program stakeholders. He previously served as a Community Program Specialist in the Water and Environmental Programs and Community Facilities Programs. He received a BS in Business Management from South Carolina State University. That was a mouthful. Thank you guys so much for being here with us today. And we're very excited to have you. And we've been looking forward to this webinar for a while. So I'm going to go ahead and turn it over to you, Kelly.
Thanks, Cassidy. And thank you for joining us today. If you want to go to the next slide, Cassidy, please. So this just gives you everybody's names and titles and kind of what we'll be covering. And then I'm going to jump right in. So as Cassidy mentioned, I serve as the USDA Rural Health Liaison. I'm going to tell you a little bit about what that means in a couple of slides, but I am super excited because some of my friends and colleagues and rural development leaders are here today to give you some information about rural development programs and the ways that they can support rural hospitals and clinics. I include this slide because what I've learned in my time as the Rural Health Liaison is as much as I find other federal agencies to be a mystery and I can't quite find my way around, people feel the same way about USDA. We are a large agency, and I just wanted to put this chart up here so you could see there's about 8 mission areas. That's what we call them. So all of these little boxes right under the Office of the Secretary. And every one of those mission areas provides some level of support for rural health. So as an example, our Farm Production and Conservation mission area works closely with our Research, Education, and Economics mission area on issues of farm stress. Another example is around food security. Our Food, Nutrition, and Consumer Services, our Marketing and Regulatory Programs, and Rural Development all work together on the Healthy Food Financing Initiative. And additionally, the National Resources and Environment Mission Area, which is really the Forest Service, and Research, Education, and Economics and Rural Development are also working together to support recreation economies in rural communities. So that's just a couple of examples of how we work across the department to support rural health. Can you go to the next slide, please? Thank you. While I do work across USDA, I sit inside rural development, and our programs are what you're going to hear about today. Rural development, or RD as we call it, has more than 50 different programs that support rural communities across 3 agencies and 47 state offices. Our Rural Business and Cooperative Service has programs that support businesses, cooperatives, and job creation, and Derek's going to talk more about that. Our Rural Utility Service has programs focused on water and sanitation, broadband and telecom, and electric generation, distribution, and transmission, including some renewable energy relending programs that some of you may have heard about a little bit earlier this year on a Department of Health and Human Services webinar. But Teresa is here to talk about broadband, and I think you're going to be excited to hear about some of the work that they're doing. And then also our Rural Housing Service, which supports everything from single-family home mortgages and repair grants to large community facilities, and Chad's going to talk about that. I will also point out the Innovation Center. It's this little box hanging out there right under rural development, and that's where I sit. So in the Innovation Center, we have folks that are experts in data analytics and regulation and policy and strategic engagement. And miraculously, in order to do my job, I need to have access to data and analytics, regulation and policy, and strategic engagement expertise. So I'm excited about doing my job from where I sit and being able to work across all of rural development. Next slide, please. So you may wonder, what does a rural health liaison do? A big piece of what I do is work across rural development, work across USDA to help support with resources, partners, information, everything that I can bring to the table around rural health, but also to gather feedback about the issues and concerns that folks are seeing out in their communities where they're working. So I can bring that back across USDA to help us support rural health, but also in our relationships with other agencies and partners. So the Rural Health Liaison role was created in the last Farm Bill in 2018 by Congress. And I've included the 9 things that are in the statute, but I will summarize them as saying it's all about coordinating and collaborating, both across USDA and between USDA and our partners and stakeholders, especially our colleagues at the US Department of Health and Human Services. I've been in the role since earlier this year and have been working to establish and strengthen the relationships between USDA and our partners and stakeholders with folks like you and the Center for Optimizing Rural Health. I've been working with staff in the Innovation Center and across USDA to develop some tools to increase awareness across USDA staff about all the programs and resources that we bring to the table to support rural health. Next slide, please. As I wrap up my presentation, I wanted to share this little picture that it kind of represents to me. It's all a web where we're all interacting with each other. We do want to work with community leaders, federal, state, local partners, philanthropic organizations, and folks like you at hospitals and clinics and healthcare practices to make sure that we're doing our best, not only to support rural health care, but all aspects of rural health, from affordable housing to accessible transportation to workforce development and so on. I know we're going to take questions at the end of the presentation, but please feel free to share not only your questions, but also your thoughts about what USDA and rural development are doing and the kind of support that you think may be helpful for your communities. And with that, it is my pleasure to turn it over to Chad Parker.
Thank you, Kelly. I appreciate that. So I'm Chad Parker, Deputy Administrator for our Community Facilities Program. We can go to the next slide, please. Under our programs, there's been 3 major priorities during this administration: equity, recovering from the COVID-19 pandemic, and reducing the impacts of climate change. So we kind of put those as a lens over all of our programs, and when possible, include those items as priorities for rural development. So if we have a notice going out in the Federal Register and we're able to give priorities to certain types of projects, we have been leaning towards these priorities. For the Community Facilities Program, we have specifically focused on recovering from the global COVID-19 pandemic with an emphasis on healthcare. So we've really ramped up our funding of healthcare over the last year or so. So next slide, please. Essential community facilities. Everybody asks, what are they? We basically fund the things that improve the quality of life in rural America. So I like to describe it: if you're not a utility, water, telephone, or electric, and if you're not a business, you probably have a good chance of being eligible for the Community Facilities Program. Our funding goes to public bodies and nonprofits and Native American tribes. And it goes into purchase or build or construct or renovate essential community facilities. The funding comes in the form of direct loans, guaranteed loans, and grants, and we provide it on a competitive basis around the grants. But basically, we have more funding than we have more funding available than we have demand for the direct loan and guaranteed loan program. So those funds they have a scoring process, but they're not competitive. If you've got an eligible project that meets our eligibility requirements and our feasibility requirements, then we usually find a way to fund that. Next slide, please. So this is just, it's mainly a takeaway slide, so that if you're interested in learning about the community facilities program, or you want to save one slide maybe to drop in the back of your email or in some sort of folder, it gives you the basics of what community facilities can do. It lists our programs, our direct loans, guaranteed loans, and grants under the community facilities. And then our other technical assistance programs, the technical assistance and training grants, the Rural Community Development Initiative, and then our specialized program for the tribal colleges, the 1994 land grant institutions. For this program for healthcare, I think the things that you need to be aware of are the dollar amounts to the right-hand side. Our typical allocation for the community facilities direct loan program, it was $2.8 billion last fiscal year. We used $1.3 billion in direct loan funding. So we have a substantial amount of funding that's available, authority that's available for USDA to use that went unused in FY22. And actually, we've had more funds available than we've had demand for the last 4 or 5 programs. So there's ample funding available in our direct loan program, as well as our guaranteed loan program. We used about $300 million in our community facilities guaranteed loan program. So we had more funding available there as well. The CF grants are way oversubscribed, of course. We had $36 million available in community facilities grants, but the amount of demand was just tremendous. So we allocate those funds across our rural development state offices and field offices, and then they gather applications throughout the fiscal year in those state offices and fund them. So each state office gets about $500,000 to somewhere around $1 million a year in grant funds, depending upon the size of its rural population and the demographic characteristics of its rural population. So the average size CF grant, just so you have it right in your head, is about $50,000. And so they tend to go towards equipment and vehicle purchases and not towards construction of facilities. I think we can go to the next slide, please. As I mentioned, our eligible applicants for the community facilities program are public bodies, nonprofits, and Native American tribes. To be an eligible facility, it has to be located in a town of 20,000 or less, or out inside the unincorporated area in a county, to be eligible for the direct loan and grant program. Our guaranteed loan program has a higher population limit. It's 50,000. So if you're a community between 20,001 and 50,000, the community facilities guaranteed loan program kind of helps fill that niche, because you become ineligible for the community facilities program, direct loan program, at the 20,000 limit. The projects also must primarily serve rural residents. So even if your project, you're building a hospital right outside of a large city, it might be in an eligible location, but we're going to take a look and see whether or not you're primarily serving rural residents or whether it primarily serves the residents of the large city. So we do take a look and make sure that the projects not only are located in a rural city or town, but also are primarily serving a rural city or town. The last thing here, and it doesn't not usually become a factor for many healthcare facilities, but if an organization is able to fund the project through their own resources, or able to go out and work with the banking community to get reasonable rates and terms, then the community facilities program is not allowed to provide funding for that type of project. So we do have what we call an other credit provision. If you can get other credit, then you're not eligible for the CF program. So next slide, please. What types of facilities are eligible for the community facilities? So like I said, we do building, construction, purchase, renovation. Vehicles and equipment are our primary items that we fund. For healthcare, it's pretty broad. I'll go through a kind of a list. Physician clinics we funded, dental clinics, nursing homes, assisted living facilities, hospitals, all kinds of hospital equipment, all kinds of hospitals, psychiatric hospitals, general hospitals, critical access hospitals, telemedicine projects. We fund all types of outpatient care, medical rehabilitation centers. We've even had a few home healthcare projects where we funded the main administration building for the home healthcare entity. We do medical office buildings, mental health clinics offices, migrant health centers, and also a variety of mobile health clinics. We funded one fairly recently in the Appalachia that serves about 15 communities and serves a couple of communities each day, and it rotates and drives around to the different communities every day of the week. So I think that's pretty broad. And if there are other facilities that you're thinking about around healthcare, they probably are eligible for the community facilities program. It's not an all-encompassing list. Next slide, please. The CF Direct Loan Program. What's I think most exciting about the CF Direct Loan Program is the subsidized interest rate for most of our borrowers. Right now, our interest rate is at 3.5%. The interest rate, once you lock it in on your loan, it's a fixed term. So it stays fixed for the life of the loan, but it does change quarterly based upon the 20-year municipal bond rating. So right now it's 3.5%. It will be reevaluated on January 1st. So that when we take a look at what the new rate will be starting in January. So you've got a couple of months at the 3.5% rate still. The municipal 20-year bond rating has been trending right around 4%. So I think it will go up a little bit in January. Our loan terms are also much better than what you can typically get on the commercial market. We have a 40-year term for our community facilities direct loan program, or the life of the facility. Average life that loan term that we probably see is somewhere between 30 and 35 years. It's usually based upon the life of a new constructed facility. We do require that we take a look at and make sure there's adequate security. So we take typically a lien on the building, a lien on the facilities and the land that the facility is located on. We also do a feasibility analysis to make sure that the applicant can repay the loan. Next slide, please. The pre-application process. I always try and tell people that the main thing that they need to do is they need to reach out to our rural development field office. In every field office, in every state office, we have a community programs director. And then there's a handful of people in each state that work with the community facilities program. Better to bring those people in early on and have a discussion with them about the project you're planning, get an understanding of what's going to be needed for environmental review, what's going to be needed for the feasibility review, what kind of feasibility study is going to need to be done, the details on your financial history. You need to provide those and let the loan specialist and the program director in that state office get an understanding of the financial situation so they can better guide you as you work on your application. The last thing we want somebody to do is to be an applicant and to spend time developing plans and specs or developing feasibility study that doesn't meet our requirements. That'll have to be redone. So my big thing about pre-application, please reach out to the state office, talk to the community programs director, talk to the community program specialist, and learn what you need to do. Next slide, please. The great thing we have as a resource, it's out on our website, is the Community Facilities Direct Loan Guidance Book for applicants. It walks through step by step the whole process for applying for a community facilities direct loan, which is also very similar to the community facilities grant and community facilities guaranteed loan. There are different tweaks to each program, but this direct loan guidance book could give you an idea of what the information that you need to gather and helps you gather, I think, correct expectations as you begin to work with us. Next slide, please. Our community facilities guaranteed loan program, interest rate is set by the lender. So is determined between the negotiation between the lender and the borrower. It's the same with the term. We see an average term on our guaranteed loans of about 22 years. What we do with this is a private sector loan from a bank, and USDA comes in and puts an 80% guarantee on that loan. We do require an upfront fee of 1.25%, which is typically passed on to the borrower from the lender, and it has a 0.5% annual renewal fee. You typically see our guaranteed loans as a mixture with our direct loan on very large projects. We've done funded hospitals as large as $350 million. So if you're looking at a large regional hospital, and that's the largest that we've done, but we frequently see them over $100 million. And you'll typically see a community facilities direct loan and a community facilities guaranteed loan as a combination, along with other sources of funding. So that's where you typically see our guaranteed loan engaged in the process. Next slide, please. Our community facilities grants in FY21, the average grant was $42,000. I think the average grant ticked up a little bit in FY22. I think it was right around 50,000, if I remember correctly. The amount of grant that you're eligible for is based on a sliding scale, and it starts at 75% and scales down to 15% based upon median household income and based upon the population of the community that the project's going to be located in. So the smaller communities and the less well-off communities are eligible for a larger percentage grant and also score higher points in order to prioritize that project for funding. But then again, average size grant's about $50,000, so you just need to keep that in mind as you set your expectations. Next slide, please. One of the extra large groups of funding that we were given recently was under the American Rescue Plan Act, were emergency rural healthcare grants. We advertised that through the Federal Register notice back in October of 2021 and have been processing grants since then. We had $325 million available through the Track 1 grants, and those grants went up to $1 million. And right now we have just over $50 million of that funding that remains available. It can fund a lot of the same things as the community facilities program, equipment, facility construction, facility expansion for rural healthcare facilities. We've done a lot of HVAC system renovations, a lot of working on patient waiting rooms, making sure that they are separated so that you can have patients that are pandemic impacted separated from the rest of the patient population. Our Track 2 impact grants, we were set aside $125 million for those. We had $662 million in requests off the initial notice. So we've been working our way through the process, and those funds are no longer available. So there are about $50 million of the Track 1 grants that remain available. So if you're going to come into for those, you need to be talking to our area office or state office in the very near future. And next slide, please. We also have a cooperative agreement that's set aside with the National Rural Health Association. And we have are appropriated $2 million each year from Congress to help with technical assistance for rural hospitals. And so what we fund is we work cooperatively with the NRHA and through our field staff on selecting hospitals that will get a review done by experts. So we hire accounting firms or consulting firms to go in and have somebody review the hospital's operations, their finances, and take a look and how they do their reimbursements, how they work with their insurance, what services they're providing. And they'll do this review and then provide a set of recommendations back to the hospital on how to become more financially sustainable. And so I think we've assisted 32 hospitals so far. We were again appropriated $2 million in FY22 that we're now beginning to make available for that technical assistance as well. So if you're a hospital that has questions or struggling to figure out the best way to maximize your financial capabilities, then we encourage you to reach out to NRHA or our rural development staff, and we'll get your hospital under consideration for that activity. Some project examples. Next slide, please. Just through a couple of them. This one I really like it. The Ann Carlson Center in North Dakota. It helps with developmentally disabled children, but also young adults, children that have on the Asperger's scale, children or young adults that are trying to gain skills to assimilate in the community. We put in a $27 million direct loan, a $6 million guaranteed loan, a 600,000 emergency rural healthcare grants, and the community went out and raised $8.6 million for this facility. Very neat project. Next slide, please. We fund critical access hospitals. And this one, we did a $50 million direct loan, a $5 million guarantee, kind of that combination that I was talking about earlier, along with $1 million emergency rural healthcare grant. The applicant raised $5.1 million and raised some state money as well. We fund a tremendous amount of critical access hospitals. In FY22, we funded $1.3 billion in rural healthcare projects. And I'm looking at the critical access hospital number. It looks like it was a total of 103 loans and grants, 148 loans and grants to 103 critical access hospitals in FY22. Next slide, please. That's the Appalachian healthcare mobile healthcare facility that I was speaking about earlier. Pretty neat health wagon. It had direct loan funding and grant funding in that as well from community facilities. Next slide. In Pennsylvania, we did the Elk Regional Health Care Center. We did the heating system with a $300,000 loan, and then constructed the facility maintenance building that housed the boiler and the other maintenance items for $1.4 million. Again, I had mentioned climate change earlier as one of those items that is a priority. Certainly replacing heating system with a biomass energy efficient heating system fits that climate change window. Next slide, please. The Illini Community Hospital. 900, and this one is great because it combines not only the community facilities program, but they also found other resources from our sister agency in Rural Utility Service, both receiving an emergency rural healthcare grant and a distance learning and telemedicine award, which Teresa will tell you about in a few minutes. Next slide. And the North Cato Medical Center in Louisiana, again, a combination of emergency rural healthcare grants and distance learning telemedicine funding. Next slide, please. And I think I'm going to turn it over to Derek. Community Facilities has about a $12.2 billion portfolio, loans, direct loans, guaranteed loans, and grants, and just over $6 billion of that is in healthcare. So healthcare is our primary activity. So if you've got an interest or know somebody who has an interest, we'd encourage you to have them reach out to us. Thank you. And Derek, take it away.
Thank you, Chad. My name is Derek Jones, and I'm the chief of the Public-Private Partnership branch of Rural Business and Cooperative Service. Here to introduce you to the Business and Industry Loan Guarantee Program, or as we refer to it, the B&I program. I'm also going to discuss the Rural Economic Development Loan and Grant Program, often referred to as the Red Leg Program. And we can go to the next slide. Chad mentioned with the CF Guarantee program, he mentioned 1RD. And the 1RD Guaranteed Loan Initiative, it encompasses not just CF, but also Rural Business and Cooperative Services, B&I program. And it's a standard regulation and process for guaranteed loan making and servicing across rural development programs. So it includes two of our programs in rural business. It also includes community facilities program and water and waste program. So under this initiative, USDA removed regulatory barriers and make it easier for private lenders to use rural development programs to invest in rural businesses and grassroots rural economic development efforts. So it made it really streamline the process for our potential borrowers for them to have access to these funds. We can go to the next slide. Now, when we look at the BNI Guaranteed Loan Program, uh, the purpose of that program is to improve economic health of rural communities by increasing access to business capital by offering loan guarantees to commercial lenders for their loans to rural businesses. And as we talked about this one RD program, it removes some of these barriers that you see on the screen. One of the great things about the guaranteed program, and we'll kind of talk about this a little bit later, is that, and as Chad mentioned in his presentation, a lot of these things are very similar. When you talk about one RD, they go for CF as well as RBCS, is the 80% guarantee of the loan, and that really lowers the risk aversion for a lot of our bankers. It makes it more attractive to them. So as opposed to having 100% risk aversion, if that they held that in their portfolio themselves, they were at a lower risk aversion of 20%. So it really makes it attractive to them. Now we can go to the next slide. Now, what are some eligible purposes of the BNI? Back one? There we go. What are some eligible purposes? Business conversion, enlargements, repairs, modernization or developments, purchase and development of land, buildings, facilities, purchases of equipment, and similar to CF, the loan terms are not to exceed 40 years and is based on the use of the guaranteed loan fund. So we wouldn't look at making a guaranteed loan or having a guaranteed loan for 40 years if it was purchase of equipment where the useful life may only be 20, 25 years. So they would take all those things into consideration. Now, there are some things that are ineligible for the program. And if you go to the next slide, housing, gambling, marijuana, hemp, racetracks, golf courses, it's cemeteries. So those are some of the things that are eligible for this program. But one of the good things about rural development is that rural development is one of the few agencies within the entire government that can build a community from the ground up. And that's including infrastructure, the roads, like with CF, your infrastructure with rural utilities, your businesses with rural business, your housing with rural housing. And the great thing about it is that the way rural development is structured, typically where one program stops or is unable to continue on, another one can pick up. There are some things that are across the board, like gambling and marijuana, that none of our agencies at this point can do, but they're usually when you talk about housing, there's where one would stop, the other one can pick up. So there's always some way that we try to help the community. Next slide. Now, the BNI program offers loan guarantees to lenders to their loans to rural business. And we kind of talked about a lot of these purposes before, so we'll go ahead on to the next slide. When we talk about the BNI program, the guaranteed percentage rates and terms, we mentioned it before, we offer an 80% guarantee for all loans up to 25 million. The initial guarantee fee is 3%, and then there's an annual renewal fee of 0.5%. So then the other provisions that or conditions that we look at within the BNI program is there's a 25 million maximum loan, except loans to cooperatives may not exceed 40 million. Loan funds must be used to support businesses and business assets located in rural areas. And once again, you have that 50,000 population limit when you talk about the guaranteed program. And the next slide. So just to give you a idea of what we have done in the BNI program alone, we had 264 loans or projects last year for approximately $1.7 billion. So it is a very robust program. We do a lot of projects nationwide within the BNI program. Now, we also mentioned that we were going to talk about our Rural Economic Development Loan and Grant Program, or commonly referred to our RED program. We can go to the next slide. The purpose of this program is to encourage electric and telecom utilities to promote rural economic development and job creation projects. The RUS utility previously can receive loans to help finance projects such as business startup costs, business expansion, community development, and business incubator projects. The intermediary must use program loan funds to make a pass-through loan to an ultimate recipient, such as a business. And the intermediary is responsible for fully repaying the loan to the government, even if the ultimate recipient does not repay its loan. So this is a great way for us to really build up rural economic development by utilizing the utility companies and having them be invested in the community by starting this this intermediary situation where they receive the loans and finance these projects. So this helps them to be familiar with the program as well as to invest in the community. Now, how does this program work? We can go to the next slide. So the way this program works is that RD provides zero interest loans to utilities who serve as intermediary. The intermediary uses these loan funds to lend to recipients, and then the intermediary repays back to rural development, and the recipient repays the intermediary. And then they, in turn, reuse those funds again to build up this relending program. Now, let's look at there's also a grant component to the Red Leg program. If we go to the next slide. So with the Red Leg program, the intermediary must use program grant funds along with this required contribution to create a revolving loan fund that the intermediary utility will operate and administer. And loans to the ultimate recipient are made from the revolving loan fund of a variety of projects. So this is where we see that they utilize these grant funds to build the capacity for them to be able to lend out these funds in other projects throughout the community. Next slide, please. And we talked about what the purpose was, and we can go to the next slide. The eligible use of funds. Startup venture costs, which may include real estate, buildings, equipment, working capital, business expansion, business incubators, technical assistance. There are a lot of eligible uses for this program. I will say that I went through these slides a little quick, and all of this information there's a wealth of information that's contained on these slides for your reference, as well as for you to go back and look at the programs that's eligible and some of the eligibility requirements. Let's go to the next slide. Another eligible use is project feasibility, as well as CF type projects. So there's opportunity for us to work collaboratively with some of our sister agencies within rural development, such as CF and such as rural utility. So let's go to the next slide. Limitations or ineligible uses of the funds. It cannot be used to refinance existing debt or anything any cost that was incurred prior to applying for funding. Residential purposes. So no residential purposes are eligible. If there's a conflict of interest or agricultural production, there are some exceptions to the agricultural part, and those exceptions are where the project is a farmer-owned cooperative or a similar organization where the benefits of the project are passed to the farmer only. But those are case-by-case basis that we would have to look at, and not necessarily applies to healthcare. So let's look at one of our success stories. So if we look at the success stories, we can go to the next slide. This is a great project that we had, and this project is in Kansas. It's the Onaga uh, Community Health System. And this was interesting because this particular healthcare system started as a single practice back in 1859, and it has grown to cover, I think, 3 counties within Northeast Kansas. And we utilize both CF direct loan of $17.5 million and our red leg program for $2 million. And the new hospital expansion includes surgery, emergency, and pharmacy departments, physicians lounge, as well as a renovation to provide clinic space, laboratories, and a new administration department. By doing this particular loan, we were able to save over 450 jobs within that rural community. And this particular hospital system has an annual payroll of over $16 million. So we see the tremendous impact that being able to leverage multiple programs together has had on this community within Kansas and can have in all our rural areas. Now we'll look at our next slide. So on behalf of RVCS and Rural Development, thank you for your time and your continued support. And at this time, I would like to turn it over to Ms. Teresa Hunkapiller. Teresa?
All right, thanks, Derek. That was a great presentation. And I'm going to slide right on into my presentation and for the sake of time so that we have time for a few questions. So if you will go to the next slide, please. We do distance learning and telemedicine grants. And in the program, we were allowed to do loans and grants. But over the last many years, we've only done grants. That's what people need and want. And we haven't funded the loan portion in about 14 years. So it's grants only, and it is awarded through a nationally competitive process. Ordinarily, we open a 60-day window in the early part of the year, early spring, and we try to have the obligations made by the end of September. Let's go to the next slide, please. And who is eligible? Basically, anybody that can legally do business with the federal government other than individuals and partnerships. We do towns and communities, states, local governments, for-profits, not-for-profits, institutes of higher education, tribes, and rural cooperatives. So across the board, we target almost everyone except for individuals and partnerships. Okay, next slide, please. The distance learning telemedicine program is to provide equipment, wiring, software, and other items, and to support instructional programming. And where it says to offset costs associated with technical assistance, this is the technical assistance that it costs for recipients, applicants to learn to use the equipment. So I kind of cringe when I say technical assistance because that means a little something different to everyone. So this is the technical assistance needed to learn to use the equipment that we fund. Okay, next slide, please. Examples of eligible equipment: computer hardware and software, telemedical devices. A lot of times we see these as telemedicine carts. Microphones, cameras, speakers, they all fall into peripheral items, but and monitors. We also provide a small amount of broadband facilities. It can't be more than 20% of the application, and the applicant has to own. The applicant in our program owns all the equipment. So if you have a hub site, which is a major medical facility, and you have 10 hub sites, the medical facility that is the applicant is the owner of the equipment. And if you want to discuss that deeper, I'll be happy to. There are exceptions where you can do it as a municipality, as a consortia, and That gets pretty complicated with a whole lot of signatures on a lot of documents, but we can do that if that's what you need us to do. The main thing is that the equipment has to be predominantly used for the direct connection of live interactive delivery of medical care. We won't just fund a computer or hardware because it's a computer and it's hardware. It must be used for the specific purpose of a specific project connecting live interactive connection between the professional medical personnel and or their representatives. If it's connecting a registered nurse in a school clinic to a medical institution, so that she can be the intermediary between the student and the actual doctor, but it has to have the live component. That's the main premise of our program, is we want to remove the lack of ability for people in rural areas or with lesser ability to get to specialists to have live interaction just as if they were there. Okay, next slide, please. I'll also mention some ineligible grant purposes because sometimes this gets a little confusing, but any equipment that does not have the live interaction as its essential function. A few years back, we got a lot of questions about electronic medical records. Those in and of themselves are not eligible. Now, if a system that you're buying and putting in happens to include that, we're not going to tell you you have to carve that out and pay it separate. But in general, electronic medical records are not fundable. We don't fund any salaries, administrative costs, or operating costs, no reoccurring expenses. We don't pay for the monthly broadband bill. We don't pay for things that are disposable, such as exam gowns. What we pay for is basically assets, the actual equipment that makes up this interactive connection between a patient and a doctor. We don't pay for any application preparation cost. We don't pay for the purchase of land or site development. And you can see in the Code of Federal Regulations 7 CFR 1734.21 some other things that are not eligible. Okay, next screen, please. We have some really good sources for assistance. Our website is very good. On the website, you will find a very detailed application guide. You'll find sample worksheets and checklists. You'll find past award summaries and past webinar recordings. We are coming up on a new application window in the very near future. I'll speak to that in just a minute. But you do have at your disposal our general field representatives. And on the screen, there's a link to the map that shows you who covers your area. And you can call on those general field representatives when you have questions or when you're working on an application up to 14 days prior to the closing of the window. You have to keep in mind everything is competitive. The GFRs can only share with you technical knowledge. They can't tell you if what you're doing is, will be funded. It's all competitive. So they can help you with the technical aspects, but they can't actually write your grant or coach you on what kind of project you need to propose. And one more slide, please. The other sources of assistance are the Contact Us form, and there is a link to that. And this Contact Us form was originally set up for our Reconnect program, but it's going to be shared among all of our programs. So when you go to that, you will just select distance learning and telemedicine as the subject and then put in your question, and it will go to a help desk and get directed to the right person to get you a prompt response. We also recommend that you sign up for our automated program notifications. This will alert you when we do have an application window opening. So that's, I highly recommend everybody sign up for those if you're interested in the program. And of course, our national office telephone number and our DLT mailbox. We did not have a program in an application window in 22. We used the same resources as far as staffing for our Reconnect broadband program, our Community Connect broadband program, our telecommunications infrastructure program, all function with the same group of people. And so there was definite need and requirement for the Reconnect program to get networks built out in rural America so that we can connect the telemedicine and distance learning. So it's kind of like, let's get the horse before the cart. So Reconnect got the focus of staffing hours this year, but we do anticipate opening up a traditional 60-day window. We have the funding opportunity announcement in its final stages of review. So we are hoping that that opens up. It should be imminent between now and December 31st. So we anticipate a window opening. We will hold webinars. Like I said, we will update everything on the website to give you the latest and greatest information, and look forward to helping you any way we can. I know I didn't have the time to give you a lot of examples, but we do about 50% of our awards each year are distance learning and 50% of them are telemedicine. We don't plan it that way. It is a scoring criteria, but we are seeing about the equal amount of request for funding from both directions. A project can be both, but if it is both, you have to tell us what the predominant purpose is. And we do each year have special consideration points, and those won't be released until the NOFA is published. But that again will be hopefully sooner rather than later. I'm sure I'm leaving out a few little tidbits that some of you would like to know about, but if it's something you want to ask here, that's perfectly fine. I'm going to pass it back to Kelly, and then I'm sure she will wrap us up and open up for questions. So Kelly, I'm back to you.
Thank you. And thank you everybody for your attention and your time today. We've got everybody's emails and titles and stuff on this last slide. And I think that is it for our presentation. So thank you so much. And I will turn it back to Cassidy.
Okay, thanks to all four of you. That was excellent information. Let me see what the chat box looks like. I've seen a couple of things. If you joined us late, we will be sharing the slides. I got a couple of questions about that. So you'll get an email from us with the link to the slides, as well as a recording of the webinar. And then there was a question about, and I think you didn't quite have a date, Teresa, but there was a question about the date on the telehealth and distance learning application being open, grant application.
The actual funding opportunity is in the final stages of review, and that could take 2 weeks. Of course, we have to factor in the fact we have Thanksgiving holiday coming right around the corner. So
And Christmas, sure.
Yes, and I can tell you that I'm very anxious. I've been anxiously awaiting to get this out for several weeks now. So okay. I'm very hopeful that it'll be out within the next 30 days, but I'm being told that for sure they'll get it out for me by the end of December. So fingers crossed it'll be within the next few weeks. Perfect.
And then you'll have the link to sign up for the notifications when you get the slides from us.
Sure. Yes.
And let's see. I don't see any other questions. Just a couple of thank yous to the speakers for the program, information. Very informative. Okay, well, so we have about 6 minutes left. Since I don't have any other questions, please, in the chat right now, please do feel free to go ahead and type your question into the chat if you have one, or unmute yourself and you can ask your question, just interrupt me. But I will just give a couple of bits of information before we adjourn, and then we'll go back to chat and make sure we don't miss any questions. But As I stated, you will get an email within 24 hours, and you will have a copy of the presentation and a copy of the recording. If you have any questions following this webinar, once you go through the slides again or anything, then please do reach out to us or reach out to anyone via email that's on the screen right now, and we would be happy to get that question answered for you. I did have one question just come through, maybe two. Okay. Question. Do you have any suggestions for obtaining community health workers?
I think I can make a start, and then maybe I will turn it over to Chad and to Derek and Teresa. Typically, RD programs, I use a shorthand of we usually pay for buying and building things. So more operational expenses like supporting hiring community health workers is maybe not something where we would play as much as Health and Human Services. However, I would caveat that with, we do actually have funding programs, and you heard about some of them today, that can support training, workforce training, workforce development type training, and certainly to be able to train community health workers to do the work. I think we absolutely have some programs that can support that, and I will defer to my colleagues what other specific information they want to share.
Perfect. And then someone did add in the chat, I think in response to that question, reach out to local workforce development board, WILA. And then another question that came through, how important is program design to your review process? Logic model or other approaches preferred?
I will say within RBCS, we look for innovative projects. So we're looking for out of the box thinking. We're looking for new ideas, how you're able to justify those new ideas. So as long as they're sustainable and they have evidence of sustainability and the projections are sustainable, we're definitely not averse to those, but we do want to take a look at them because we do realize that the landscape is changing, and we want to make sure that we stay ahead of the curve if possible, and that's by embracing new ideas.
Well, thank you. Okay. I don't see anything else. So I think we'll go ahead and adjourn since we have just a couple of minutes left. But again, I want to extend a very sincere thank you to our 4 speakers from the USDA. And I appreciate everyone that attended today. Thank you for your time. And we look forward to seeing you on our January webinar, which is going to be on 2023 E&M coding updates. Thanks, everyone. Have a great afternoon.
Thank you.
Thank you.
Thanks. Bye.
Bye.